All right. Well, let's get started. So welcome. This Research and Practice Showcase is about climate impacts and climate resilience in Indonesia's coastal communities. So we've got 3 papers today. So lots of time to for everybody to get through their presentations, and we'll have time for questions as well. And our first speakers, and maybe we'll just pop them up on the screen. Their paper is called Beyond the Shoreline, Assessing the Impact of Coastal Tourism on Individual Wellbeing. And we're just going to be hearing today from Vika Septi Rahmawati and Nabila Intan Permatasari as the speakers, but they were part of a larger team, Kus Afifah Kuratani Putri and Dewita Prastiwi. So you can turn your cameras on now. And I understand you're going to be sharing your presentations. So we've got people in the room here, and we've got people online as well, not only presenting, but also this is being streamed live. So if you're joining us online, welcome. The other one to pin is Vika. That's it. And you can take the third one off. Yep. Hello, how are you going? Can you see us here? And
yes, we can see. Thank you
Excellent.
so much for this opportunity.
All right. I'll hand over to you now. Thank you so much, Vika.
Okay, I want to start the presentation. Good afternoon, everyone, and thank you. First of all, I would like to thank you for this opportunity that have been given for my team to present our paper. I want to introduce the member of our team. First of all, let me introduce myself. My name is Nabila Intan Permatasari. You can call me Intan. Together with my team, with Dewita, Vika, and Afifa, we wrote the paper with the title Beyond the Shoreline, Assessing the Impact of Coastal Tourism on Individual Well-Being. So the next slide. Okay, so this is the content of our paper that we want to present. So why coastal tourism? The relationship between the tourism and economic development have been widely discussed in economics and regional development literature. Previous studies have proven that tourism generates many positive impacts, such as creating employment, increased income, and improved well-being and livelihood. In the United States, the National Oceanic and Astronomic Administration, or NOAA, record 2.5 million employment in ocean-based tourism and recreation, with individuals earning approximately $65.6 billion annually. The International Labour Organization also stated that the tourism sector employs about 8.2% of the global workforce with a total of 270 million workers. Next. Yes, this is in Indonesian case. Indonesia has a high marine economy potential, especially from tourism activity and fisheries. A 2024 report from the Indonesian House of Representatives state that Indonesian marine conservation area reached about 20.87 million hectares with around 99,000 kilometers of shoreline and sea area raising more than 3,000 million kilometers square. In 2018, Kemencraft state that Indonesian marine tourism attraction have an economic value of approximately 18.5 trillion Indonesian rupiah. And the previous study have a lack of assessment of the impact of tourism on household and the individual level development, especially in the case of coastal tourism. Because of this gap, our study attempt to fill the considerable gap in the literature of tourism and individual level impact. So we took the study area limited to 738 coastal districts across 13 provinces in Western Indonesia, and we use of spatial data to determine tourism areas and activities, and then we integrating them into the econometric models to produce quantitative analysis and evaluate impact. And then for the literature review, the study on the impact of tourism have consistently demonstrated its significant role in the thriving economic development and improving welfare outcome. On the macro level, tourism has a positive impact on GRP and overall GDP, real exchange rate appreciation, reduced unemployment, and higher sales and value added. Navala and Bagat 20 and 22, also Duffy 20 and 15, found that the resident in the coastal area increased the household income and social economic development driven by expansion of tourism activity. Besides that, Buyan and Darda found that coastal tourism ensure local participation and then social well-being, local empowerment, cultural exchange, and then integration of local language and the maintenance of social relationship. Next. This is the slide of methodology to examine the impact of increased economic activity on individual well-being. We employ a similarly linear model. The estimation of the simple linear model is subject to potential endogeneity issue. This issue may arise due to unobserved variable that correlate with both coastal tourism activity and individual well-being. So this can resulting in bias parameter estimation. To overcome this bias, a fixed effect estimation is implemented. So next. Okay. To gain the aim of this study, we use 738 subdistrict coastal area in 13 province in western of Indonesia. So we have a methodology framework. The tourism economic activity is proxies by nighttime light data, and then tourism economic activity is assumed to have a positive effect on individual well-being, which will be measured in the term of subjective well-being, living above the minimum wage, living above the poverty line, employment status, per capita expenditure, and income. Next.
Okay, so the next is the data. So in this study, we use rich panel datasets from Indonesian Family Life Survey, or IFLS, and we use three wave 3 in 2000, wave 4 in 2007, also wave 5 in 2014. And for our study, our sample is limited to the people with productive age. This is range for 15 years old until 64 years old. And our dependent variable are household monthly income per capita. This is measured using expenditure, household education investment, subjective well-being, individuals living above poverty line, and also individuals wage above regional minimum wage. And for independent variable, our independent variable are coastal economic activity. This is proxied by nighttime light by sub-district. And our control variable are education, gender, occupation type, household size, and also province. We use nighttime light data as a proxy for coastal economic activity. This is sourced from NOAA National Geophysical Data Center, or NGDC. And here is the appearance of the nighttime light data we use. This is from 2000, 2007 until 2014. And because IFLS just cover 13 provinces Indonesia, we just use coastal areas from these 13 provinces. Brighter coastal areas reflecting higher economic activities in these coastal areas. And here is the luminosity of the digital numbers of luminosity. This is 63 is the highest level and 0 is the darkness. Next slide. Okay, so there is the impact of the coastal tourism on individual economic outcomes. So based on our estimation result, 4 out of 5 outcomes are significant at 1% level. Coastal tourism, proxied by net template, have a positive impact on monthly per capita expenditure, monthly income, earning above regional minimum wage, and also employment status. So this positive impact on the economy is driven by increased economic activity from coastal tourism. The mechanism is tourism activities at coastal areas. This is contribute to local economy through their spending at tourist destination. This is result in increased sales, domestic product, tourism-related fees, and also culinary offerings. And also, tourism activities in coastal areas can increase the hotel revenue and make a positive cross-sector impacts from local service to manufacturing. And all of this expenditure have been shown to increase revenue, value-added labor income, and also job creation at municipal level. Next slide. Okay, so the next one is the impact of coastal tourism on subjective well-being. Based on our estimation result, coastal tourism proxied by net template has no significant effect on subjective well-being on the ordinal scale from the 1 is the poorest or the 6 is the richest. This suggests that changes in coastal activity are not associated with meaningful change in individual self-rate well-being. This is show that increase of coastal tourism does not substantially change the likelihood of individuals perceiving themselves as the poorest or the richest. Next slide. Okay, so here is our conclusion. The first one, the research show that increased coastal tourism activity measured by illumination of nighttime light positively impact monthly per capita expenditure and income by 1.5% and 2.6% respectively. And individuals in coastal communities also experience a 0.4% increased likelihood of earning above the regional minimum wage and 0.5 higher chance of employment. And there is no statistically significant impact are found for individual subjective well-being, which might be caused by inconsistency of the measurement due to its self-assessment nature. Next slide. Okay, so the last one, this is our recommendation. The first one is policy recommendation. Based on our estimation result, shows that coastal tourism has a positive impact on most economic outcomes. So coastal tourism can be used as a strategic tool for regional development programs, but this is need cross-sectoral synergy, for example, like integration with labor-intensive program, empowerment of tourism MSMEs, and also intensification of local labor employment. And there is no significant impact was found on poverty elevation and subjective well-being. This is indicate that there is inequality in the distribution of economic benefit from coastal tourism. This is meaning that communities with lower income receiving much smaller benefit. So government should supported the local employment through the targeted skill development programs to enhance individual access to stable income, opportunities for the personal growth, and also increase social participation within tourism-driven economies. And the last one is the government should raise awareness of income opportunities from coastal tourism through targeted programs or public campaigns. And for the future research recommendation, our study just intentionally confined on the coastal tourism. So future studies can adopt a broader perspective encompassing various forms of tourism to assess their diverse impacts on individual well-being. And also our study just limited to the regional coverage of our IFLS data. This is just restricted to the 13 provinces. So to achieve a more comprehensive national understanding, future research could be incorporated or shoreline districts across Indonesia. Next slide. Okay, so that's all for our presentation. Thank you very much for your attention. Your suggestion and input will be very valuable for this paper. Thank you.
And Intan. And I forgot to mention that all of you, I think, are final year undergraduate students at Universitas Gadjah Mada in Yogyakarta. Intan, you are in urban and regional planning engineering, and the other authors are in economics. And I was reflecting because I love the way you put up there that simple linear. I looked at it and I thought, oh, that looks very scary. And I guess I approach some of these, in some work I'm doing at the moment, I'm approaching some of these questions from a very different perspective. And so it was really interesting to hear, particularly your finding around coastal tourism and having an impact on economic well-being and economic growth and people's incomes, but not so much an impact on subjective well-being. And you say that's, you know, could be because about, you know, inequality in distribution of the economic benefits. I find that really interesting. One of the things that I'm looking at the moment in my work is what does empowerment mean to people across different areas of Indonesia? And so finding out, you know, what does actually well-being mean to people? What, you know, is it about sort of their economic growth? Is it about their connections in community? And so this is a really nice way of seeing this from quite a different perspective. So thank you very much for that. And I'm sure our colleagues here and perhaps online will have some questions for you a little bit later. I'm now going to introduce our next speaker, Pak Sujarwoto. He is a senior lecturer at Universitas Brawijaya, which, as we were talking about before, is, he and I were just discussing, that's in Malang, which is a lovely city in Indonesia. And I said, when I went there a very, very long time ago, the water was very cold. That's the one thing I remember about it. Apparently it's not so much now and much changed. But welcome, you're going to be talking about, I guess, a difficult topic, about suicidal ideation among Indonesian adults. And so I'll let you explain your paper. Thank you.
Thanks again, Bu Liz, chairing this session. It will be great. And also thanks to participants who are attending this session. It's really helpful as well. So today I'm going to share with all of you about suicide ideation and 8 risk factors in Indonesia using national representative data actually. So why this topic is important? It is of course about suicide. Yeah, and last year Lancet Global Health reported that there is around 700,000 deaths in the world wide due to suicide. This higher or surpassing malaria, HIV/AIDS, and also of course warfare as well. And in Indonesia, WHO estimate there is around 6,000 something suicide annually. But this data, of course, underreporting because suicide is stigma in our society as well. So why suicide ideation? Because suicide ideation is, of course, previous research found that suicide ideation directly linked to suicide, and therefore it is important to know what its risk factor. So this is the data that I use. I use the Indonesian Basic Health Survey, or we call Riskesdas data. This is one of national representative data on health, which have a question on suicide ideation. I also use village census data or PODES to capture some factor within districts, to capture 3 factors at least. One is community social capitals, measured by the density of community activities in the villages, and also the tradition of gotong royong in the villages, whether the tradition of gotong royong exists or not. And also I use the data for capturing social deprivation, which measured by the density of crimes and some type of social conflicts in the community. And also I use districts gross domestic product to capture whether economic development in particular district associated with suicide ideation or not. The sample size is quite large because it is representative for municipality or district, so that we can apply some statistical analysis, yeah, to look at whether some factor within district link with suicide ideation, which is in individual level. So the measurement of suicide ideation is this. And there is a question in the survey asking, have you frequently thought that you better off dead in the past month? So this is the only question that we have in the data. Yeah, there is no perfect, but we try to analyze the data that we have. So we use multivariable and multi-level logistic regression to examine individual and district level correlation with suicidal ideation in Indonesia. So basically, we have two kinds of structure of data. One is in district level, yeah, which is aggregate, and the other is in the individual level. So we try to link those to understanding whether the contextual level, which is in the district level, associated with suicide ideation among individuals. So this is the finding. So the overall prevalence of suicidal ideation in Indonesia is below 1%. So, but the total number is about 5,000 something. Yeah, which is for me it's quite large number because 5,000 is all the most people. So, and the gender ratio is 2.1, in which men had suicide rate double than women. Yeah, so yeah. And this is a geographical distribution of suicidal ideation based on the survey. So we found that in northern Papua, especially in coastal areas, showing a high number or high percentage of suicidal ideation, more than 4%. And then in Kalimantan, northern and central areas showing high prevalence. In Sulawesi and central and northern region particularly affected. And the other is Eastern Nusa Tenggara, Sumatra, Bali, and West Java. Yeah, when we see here, we clearly notice that those areas actually, when actually poverty is high, and some problem related to social deprivation, conflicts, and also some of them high crime in this area as well. And this is the picture of prevalence of suicidal ideation across all districts in Indonesia. As you clearly seen, yeah, in remote islands and also in district across coastal area have higher prevalence of suicidal ideation. This also maybe correlate with the issue of climate change, because in our another paper we show that there is a strong link between climate-related hazards such as hurricane, typhoon, and flooding across coastal area on mental depression. And mental depression, in previous studies, say that there is a strong link between mental depression on suicide ideation. How about individual risk? yeah, male gender have high risk, post divorce status, and then older people have high risk to to suicide ideation, and behavior smoking is related to suicide ideation, and then some socioeconomic indicators such as lower education, unemployment, and also lower household expenditure, which is related to poverty in terms of economic. And then health status, chronic illness, and then poor self-related health and stroke also show high risk. So how about protective individual factor? There is marital status, education, and employment shown that have negative association with suicidal ideation. How about district level factors? Well, this is, I think, the most interesting part of our paper. We've shown that community social capital, higher community social capital was associated with reduced odds of suicidal ideation. And then, in other hand, social deprivation, higher social deprivation, as measured by crime rate, community conflict, increased odds of suicidal ideation. And lastly, higher district GDP, gross domestic product, was linked to lower odds of suicidal ideation. So this is the predicted margin which shown this result, that community social capital and GDP associated with lower of suicide ideation. On the other hand, or in contrast, social deprivation associated with increase of suicide ideation in Indonesia. So then how actually community social capital in the context of Indonesia may explain this? Well, I think social capital in many literature associated with sense of belonging and also social support in Indonesia. We have gotong royong tradition, we have arisan tradition, in which become a media, especially for female or mother, sometimes to communicate or to share their problem, and also sometimes support each other when they find in difficult situation. And then the other is set norm, and also of course community empowerment, because in many case, social the village who have a strong social capital to some extent have higher community empowerment. Say, for example, we call it in Indonesia swadaya masyarakat, meaning that when a problem, then people around village collect sources, not only in terms of money, but also maybe some physical activity or some small food together, and then give to people, their neighbor who have suffered. And then social deprivation effect, of course, it is otherwise, because social deprivation related to chronic stress, eroded social cohesion, and also normalized aggression, and but most importantly is limited access to service as well. Say, for example, in part of community who have high conflict in Maluku, in Papua, to some extent, people in those areas who have high conflict have limited access of service due to it's impossible to provide good service in this area. And then economic prosperity as protection, I know. And then this year it is global comparison, but again, we have to note that this number perhaps underreporting as well. in Indonesia, suicide ideation is lower than other countries compared to China, USA, even India and South Korea. And then this is our study limitation, single measure of suicide ideation, yeah, and then also cultural factors, cultural variation in expression and interpretation of suicide ideations might not be adequately addressed in this survey. And then also risk assessment, single measure may also fail to differentiate between passive thought and active plan, limiting accurate risk assessment. Yeah. And then what is policy implication? Well, at least with MAP, we know the targeted intervention, which area who have high prevalence and not. And then community building, how to enhance social capital through support programs and also traditional gotong royong practice. And then how to address, it is important to address social deprivation, especially in the area of conflict and crime. And then lastly is economic development, inclusive economic development, I mean. This is my last slide. I think the Indonesia now need a comprehensive preventive strategy to address suicide, which link in terms of health access, crisis intervention, stigma reduction, community support, and also economic opportunity. I think that's all, and thank you for listening.
Thank you so much, Pak Sujarawoto. I wrote down so many stuff because that was really, it just strikes me as such a rich source of information. And I'm glad you got to that policy implications, because that's kind of was my next question. You know, there's so much that the Indonesian health departments could do, both the national and regional health departments could do with really great information like this. But I won't take up time. We'll save the questions to the end. I'm now going to go back online and introduce Pak Nizar, if you're there. Pardon me?
Yes, I'm here. I'm represent as a manager.
All right, we're just trying to get you up on screen, so just bear with us just a minute or so. It's under Fika. Fiki, sorry, Fiki. Oh, I see. I'm sorry. Okay, so I apologize, Fiki. So you'll be giving the presentation instead?
I'll be doing the introduction. Fiki will help.
Okay, all right, excellent. No, we're iterative and adaptive here. So, so we have Vicky online and Caroline Chan here. She's a professor at the University of Newcastle. And you have some other authors as well who were not able to come. Bui Kam, who is a professor at RMIT, and Wahyudi Agustiono, who is an associate professor at Universitas Trunojoyo in Madura. And so the paper today is called Harvesting Hope, and I like that. I think it's a nice, it's, you know, excellent information, but it's a nice to end the presentations with something hopeful. Integrating renewable energy, clean water and seaweed farming for climate and livelihood resilience in Madura's saltwork communities. So I'll hand over to you, Caroline.
Hello, everyone. Good afternoon. Okay, so my name is Caroline Chan. So I'm a professor in University of Newcastle, but I'm also an adjunct professor in Monash University. So are there anyone know from Monash here? Anyone from Monash? Brilliant. Thank you for the support. And anyone know where is Newcastle? Well, if you haven't been there, you must go there. It's 3 hours from here. You can take the train like me this morning, and you will be in the most beautiful beach. I wouldn't say Australia, everyone wouldn't like it, but it's a beautiful place, okay? So please do that. Okay, so this project is a project of us, which is currently It's actually completed, just completed, but we got an extension to do the next one. I will explain a bit more. So we do have a title, a very catchy title, Harvesting Hope, which is on the renewable energy, clean water, quality salt for Madura Saltworks community through seaweed farming. So normally people will just say Harvesting Hope because it's too long to spell the whole lot. So I'm the team leader for this, but I have other, which I'm going to show you my team members, and I will explain a little bit of background about the project. And after that, there is a technical bits that Pak Nisar, which is my team member, supposed to present, but unfortunately, he's unable to do that. So I have my research assistant. He's brilliant, and he will help me to explain some of the technical, but I did tell him that he needs to limit it to maximum 10 minutes. Okay, so the project, firstly, I have to say the project is funded through Connexi. So if you attended Connexi session before, then you know who is Connexi. Connexi is funded through the Australian government, but it's a platform for the knowledge partnerships for the collaborative research of Australia and Indonesia. So I just want to thank Connexi and the team, and Cecilia here representing Connexi, in the room, but I know the whole lot of Connexi people is watching me at the moment from over there. So thank you for their support. Okay, so now let's go to the next slide. Okay, remove all spotlight video. Okay, so this is our group member. Maybe can I use that one? So I can walk. I don't like being over there because I can't see the slide properly. Can you hear me? Yes? Okay, so this is our brilliant team. So myself there in the middle, they took my picture about probably that 20 years ago when I was still pretty and young. And I don't know where they took it from the internet, I have to say. So anyway, one of my members. And then next to me on the left-hand side there is Pak Wahyudi. So Pak Wahyudi actually was my PhD student. So he was from Deakin University, graduated from Deakin. Now he's an associate professor in the University of Trunojoyo, Madura. I'll tell you a bit of the background of that, but if I talk too long, please stop me. And next to me on the left-hand side is Professor Bui Kam. So he's from RMIT University. Long time ago, he used to be my lecturer. Yeah, so my professor. So we are kind of 3 generations, you can see that, yeah? But that's what Connexi is about. That's what the connection is, that's where the relationship, I think we learned that from the keynote speaker today, Yeah, so you always have connection to other people. Like what I discovered with Pak Jarwo. We connected through a friend too. We know someone very important. Okay, so next to Pak Bui is actually Nisar. Nisar is the brain of this project in terms of technical and mechanical engineering. He is currently studying in the Malaysian University, and at the moment he's in the factory collecting data samples, and he wasn't allowed to go by his supervisor, so that's why he's not attending. He's supposed to explain all of these technical bits. Now, on the right-hand side there, on the most right-hand side there, Pak Saki. Pak Saki is from Ministry of Marine Affairs and Fisheries. So he's from Ministry, and he's a very, very good in terms of how our project can help shaping the policy in Indonesia, and how we can also get some of the information about what's happening in Indonesia. For example, Indonesia now planning by 2030, I think, to be swasembada garam. so self-sufficient of salt production. So we know that, so kind of we're able to align our research toward that and thinking ways of how we can influence that, as well as they can see our research and how they can achieve their goal through the various research that we're doing. So I think that gives you a bit of background of the project. So how we come into the project, probably that's one thing. So the background of it. Okay, I was born in Surabaya. Anyone from Indonesia here? Yeah. Anyone from Surabaya? Yes. We brother and sister. Anyway, so I was born in Surabaya. That was a long time ago, but I've been in Australia for 35 years. So I built my career here. So I'm professor doing my job here, but I love Indonesia still. You know, you were born there, you have that connection again, you know. Yeah, so when Koneksi project coming in, I was talking to Pak Yudi. So we are very close. Pak Yudi is like with me, like, you know, I'm like his mom, yeah. I'm a PhD supervisor, you know. So, and then we're talking about this, and we start looking at what are the issues in the community. And Madura, how many of you know Madura? Oh, only one, two, oh, a few of you know, yes. So Madura is a small island next to Java. Okay, and in Madura is a very poor island in a way that poor not just economically, but probably Pak Jaro can kind of understand this, you know, but also in terms of the scarcity of water and food and other things, you know. And I remember my used to be boyfriend and now a husband come from Madura. He's Madurese. When he was dating me, he took me to Madura, and being a Javanese, I always think Madura doesn't have any plants or trees even. So I went to Madura, there are some greenies there. And I thought, are they made of plastic? And my husband said, oh, you're so terrible, you know. And yes, Madura, no, they do have plants. Of course, they do have trees. But they are not as fertile as Java. Java, you can see all around you are green, and everything you throw on the ground will grow. You know, that's Java, you know. So Madura, that's Madura. So we then look at what the problem there. And the problem is, yeah, they have a scarcity of water, and they are petani garam, they salt farmers, and they are solar salt. So what they do is they harvest the seawater, put it in the big hole or dam or whatever, and dry them until they got the salt. So the salt is not like a very high quality because the way traditionally they do that. So that's one of the problem. And second, economically, it's very poor because you can know the price of salt, 1 kilogram is about 700 rupiahs, and 700 rupiahs is about 7 cents. 7 cents, okay. You buy here 100 grams of salt, what, $7? Okay, so you can imagine how difficult it is, yeah. So that's second, and third, they don't really have a lot of electricity, being a lot of electricity. I said, of course there are electricity, but to be able to do something, you need electricity. So that's kind of some of the problem. And economically, because of the garam, because of the salt that is very low in value, we're then thinking they start interested in growing some seaweed. Okay, it's because seaweed has more value. It's more expensive when you sell seaweed. So looking at all of those issues, so we're thinking maybe we can create a prototype that can somehow have a solution to what they're doing, a prototype that can deliver clean water, a prototype that probably need to come from or be aligned with their seaweed farming activities or learn from that because they knew the seaweed farming in Madura, and also something that can deliver electricity. So that's where we come with the prototype. And now I will let Vicky to present that process and that prototype to give you some idea. So Vicky, can you start your presentation? And please keep it 10 minutes maximum. Thank you.
Okay. Okay. Can you hear my voice? Okay. Let me start.
Yes, we can hear you.
Good afternoon. Yeah. Good afternoon, everyone. My name is Vicky Melatulahyu. You can call me Vicky. And I'm honored to represent our team in this presentation. Today, I will be sharing a project that is very close to our heart. The title is Harvesting Hope, Renewable Energy, Clean Water, and Quality Salt for Madura Satwa Community through the seaweed farming. So, the problem sought to be addressed. Before we go into the technical solution, let's reflect on the real challenges, both globally and locally, that motivates this project. On the global scale, we are living in the era of the climate disruption, like CO2 emission continue to climb, causing extreme environmental change. Sea levels are rising by around 30.3 millimeter per year. We are experience 20 to 30% more heavy rainfall. Hurricanes have become more frequent and intense, up by 25% until 30%, and droughts are increasing by as much as 30%. So this change deeply affect of the coastal communities, especially in developing countries like Madura in Indonesia. These communities often live without reliable access to clean water and electricity. This lack of infrastructure not only limits their daily life, but also their potential to adapt to climate threats. So the core issues we are trying to solve can be summarized into three dimensions. The first one is climate action by integrating renewable energy to reduce emission and dependency on fossil fuels. And the second is economic empowerment by enabling farmers to produce more than just salt, such as seaweed and clean water. And the last is infrastructure access by building system that generates clean water and electricity in off-grid areas. And then we believe that if we address these three challenges together, we can provide lasting hope for the communities of Madura. So the solution, number one, is renewable power generation. One of our key solutions is the development of renewable energy system, particularly like solar power. By utilizing solar power and solar dryer, we can generate electricity sustainability for self-production processes and support other agriculture activities. This approach not only reduces dependency on diesel or grid power, but also makes the community more resilient in the face of rising energy costs and power outage. So the solution number two is multiple product output. Rather than relying on just one product, like a salt, we propose a system that enables the communities to generate multiple income streams. This include the first is potable water through desalination and purification, and the second one is seaweed farming, especially gracilaria and cottony varieties. And the last is improve the salt production using salt dryer and better harvesting methods. And this model gives farmer better economic stability and makes full use of the available land and climate condition. So this is our proposed technology. Our proposed technology is simple but effective. It is integrated solar power system with water filtration and civil cultivation infrastructure like for filtration. We are not bringing a complex machine that require a specialist to maintain. We are building a system that local communities can operate and sustain on their own. This is crucial for long-term successes. So this is our site description in Lembung Village in Pamekasan, Madura. Our research focused on several regions in Madura, Bangkalan, Sampang, Pamekasan, and Sumeneb. And we chose in Pamekasan because where daily solar radiation is sufficient throughout the year, especially between April and October. Are ideal for harvesting solar energy, and they also have the land and tradition of self-production, making them perfect candidates for this integrated system. So, and the next is salt and seaweed pond aspect. We aim to optimize the use of pond for both salt and seaweed. Salt pond will continue to be core component, but additional space will be dedicated for seaweed farming. The consistency of these two products will allow for efficient land use, share infrastructure, and diversified output, ultimately leading to better returns for farmers. And then this is our technology aspect or specification for the capacity solar panel is for under 6 kilowatt solar capacity, and then 1 kilowatt organic ranking cycle, and 1 kilowatt for pumping and water treatment system. And land allocation for this project approximately is 3 hectares for salt and 2 hectares for seaweed farming. So this system is scalable and can be replicated in other regions. We also do economic aspect from an economic point of view. The goal is not just cost efficiency, but profitability and sustainability. Initial investment will be required for infrastructure and training, but the returns come from production, producing three commodities before like salt, seaweed, and clean water. Farmers will no longer depend on one volatile market, but instead can balance income across different products. So the economical aspect from this project is we can produce for internal rate ratio is 27% and 5.40 years for payback period. And then the return on investment is 62.52%. And the last one is environmental aspect. Environmentally, our project reduces carbon emission by using solar energy. It also reduces land degradation by encouraging proper pond management and prevent water contamination by treating seawater responsibility. In short, we are not only helping the people, but also protecting the planet. So, in conclusion, our project is about more than just technology. It's about the people. We are harvesting not just products, but hope also. Hope for a better income, better infrastructure, and more sustainable future for Madura self-farming communities. Thank you very much.
Thank you so much. Gosh, these papers all really linked together really nicely. Yeah, just coming from very different perspectives, but touching on the same kinds of issues. I'm going to open up to questions in the room. And if you're online and you're using the WOVA app, you can also put things in the chat there, and I'll keep an eye on my phone and just make sure if anybody's got any questions there that I'll ask them to our speakers. But is anyone in the room got questions, comments, anything they want to say about Madura?
So is it the panel session for all the sessions or only about Madura? All of them, okay. So yeah, okay, thank you so much for the opportunity. I would like to ask to Pak Sujarwoto actually, because the topics that you raised is something that is also being my concern. I'm Rati, I'm a psychologist from Indonesia, and I would like to know about the data that you presented before that it shows that the prevalence of suicidal ideation in Indonesia seems like pretty lower compared to the India or maybe like South Korea or another country. And in the below of the slides, you mentioned that it could be several factors related to the maybe stigma or the literacy. It could affect maybe the results about the prevalence itself. So could you elaborate more about that? Is it because of in Indonesia we have highest more high stigma, so people reluctant to open about their suicidal ideation, or it is because much more the difference is they are already being more aware about that, and they feel maybe it is okay to maybe just open or not too open about the topic of the suicidal ideation compared to the one there is in South Korea or India. I think South Korea, it very makes sense because they have a very high pressure in terms of the social and something like that, what I know about that. But what do you think about the prevalence number, which is 0.87? It's still very low compared to the other countries that you mentioned on the slides. Yeah, thank you so much.
Should I answer now?
Yeah.
Okay, thanks for the important question. So, well, with regard to suicide data, which I present, so there is maybe there is of course underestimate because two reasons: underreporting and also stigma. Stigma mean in Indonesia, in our culture, say because we are Muslim, but in our religion, we know that suicide is a grave sin. Suicide, bunuh diri itu dosa besar, gitu. People want to say say that this son or this family or parent dead because suicide. And this may be linked with this because but the other reason also for suicide ideation, you see that there is prevalence very low. First, because the way the risk just measure the suicide ideation as I present in this slide, the risk has only used one single item, and this is the limitation of this. This also could be one of reasons. The other is that what you say, perhaps when the enumerator asking about the question, then they won't ask correctly or rightly, because our culture, So I think this is perhaps the reason, but I think this also good for future research, especially you are in the psychologist. For example, you can propose a good measure to measure suicide ideation in Indonesia that can be proposed to government, so that the government can have a more valid measure to calculate suicide ideation in the future. I think this is my answer.
I was going to take chair's privileges and ask a follow-on question, but it's all right. I'll save it. You go.
Thank you. I'm Johannes from Kupang. And from your presentation, I think you provide several regions that have a high rate of suicide. And I wrote on one of the article on PubMed, written by Sanderson Oni. They stated that there are 5 provinces in Indonesia that has a high rate of suicide. The first one is Bali. The second one is Yogyakarta, Riau, third, and then Central Java is the fourth one. And most of those, you mentioned about one of the key factors that may have an impact, increase the suicidal is the economical factor. But those areas that I mentioned in this article, I think they have a better economic background if we compare, like, for yours, Papua was the highest. How to like yeah, how to see this, like,
Okay.
problem?
Yeah, okay. So thank you, Pak Zuanes, if I understand you correctly. So so in our paper, in my paper, I measure suicide ideation. Yeah,
Okay.
suicide ideation. Yeah, not suicide. Yeah, this is two different things. Yeah, suicide is already dead. Suicide ideation is you think it is better to end my life. Yeah, yeah. So this is two different things. Yeah. So
Thank
I
you,
don't
Pak.
know exactly the paper. Yeah. If it is correctly. Yeah. Well, in Yogyakarta, because I originally from Yogyakarta, and in one of paper, yeah, I even read that one place in Yogyakarta who high of suicide, not suicide edition, suicide is Gunung Kidul. Gunung Kidul, there is a culture. I forget the name of the culture, but the culture is related to suicide. Yeah, because poverty, and we know that Gunung Kidul is very poor in the last time. So I don't know exactly, Pak Zuanus, but maybe later we can discuss how the paper that you read explain and the methodology that they did to present the data. I think that's all.
Thank you, Pak.
Yeah.
Thanks so much. I'd like to ask for the last presentation, Bu Caroline and the team. I'm really interested with, I know that you've already mentioned about the effect of the renewable energy and also the economic empowerment, but I'm really curious about the, I don't know if it is out of scope of the research, but is there any social or like health factors that affect the community itself for the seaweed farming? For example, like gender roles. We know that in Indonesia, there might be like a strong traditional gender norms, or like youth employment as well, and the community attitudes towards the project itself. Is there any nuance of that and how it might affect the project and the sustainability itself? And I think the other one as well, my question about the participation of the community, how community are being involved actively in the project. Do they have access or like channel to voice out their concern or in between the project itself? Thank you very much.
Thank you for the questions. For the first one, I think it's a bit out of scope, or we haven't done it, Maybe for the next extension, yes, we could look at the impact to, probably the, the employability over there and the health of the population and other things. But for the second one, yes, we couldn't have done it without the community involvement. Number one, we need a land, for example, like, to test our prototype. And to do that, we have to borrow that land from the community. So luckily, we have a community leader, and his name is Pak Haji Rohim. And if you go to the Connexi site, you actually see his profile there, Pak Haji Rohim, and his family has been kind of doing the salt farming for a long time, from generations. And he's a very kind person, and he's probably, without him, we wouldn't be able to get this project done. So yes, definitely, we got his support. And And then the community there, yes, we have to do a stakeholder engagement, which is very critical for our project, because you will need support from varieties of, not just you got the land, but also the government over there, and then the, like everybody there that you have to connect, basically. So, and then thirdly, that connection is important, but also then for testing the prototype, it takes some time, okay? Because you need to grow the seaweed, okay? And then you let it run. And that's, again, we need the support of the people over there to help us with that. And Vicky, the one who presenting, actually had to stay overnight there. And Pak Haji Rohim make him a makeshift of room. That wasn't room, it's like, a makeshift. And he has to stay there, because when the seaweed growing, you have to watch them. Sometimes the water is over the seaweed or under the seaweed. You just have to monitor that, And lastly, when we completed that, we actually were visited by, we did the closing ceremony, and we visited by the ambassador, not ambassador, consulate general, as well as with the deputy minister of education of Indonesia. And we have all of the products that, that we wanted to, as the output of the prototype, and we got all of them. But you can't just get the, drinking water and get the minister to drink it without even testing it, I'm horrified with that. So you have to involve the BPOM, and with BPOM is like Australian food standard, but in Indonesia one, and the health authority there to test the water that it is actually drinkable. Yeah, so now actually producing water, I think it's about 1,000 liters. Vicky, correct me if I'm wrong, but I think it's about 1,000 liters every 8 hours.
Yes, 10,000 gallons per day, or 30,000, 1,000 liters per 8 hour.
8 hours,
Correct.
that's correct, yes.
Yes.
So we did that, and we bottled the water, obviously, and yes, the consul general drink it. I didn't, by the way, at that time, yeah. So yes, of course, yes. Without the community involvement, engagement, and their support, we won't be able to do this. That's definitely. Thank you.
That was also my, I was going to say, while I'm bringing it over to you, I was going to say, that was also my question around, how did the community respond, but also how has the local government responded, and are they planning to kind of take anything forward from this? What's happening now?
Yeah. You want me to answer that now?
Is that all right if she answers that one first?
Okay.
And then you can ask your question.
Yes, so the government are very, very supportive, so we're thinking of scaling that up. But obviously, the next step, which is now funded through Connexi, we in the process for that, is because we finished our funding. It's finished. The project is about prototype finished, then you finish. You don't have anything. So we got additional funding now where we do the basically knowledge dissemination and the publications. So we haven't been able to publish because we focus so much on the prototype. So now is the time we can publish, do the publication, and do the knowledge dissemination, which will include creating the manual of the system, and then also training the community on how to maintain the system. So hopefully when it's all done, it's we can actually say to another region, if you want to try, you can. This is all of the. Of course, they need to adjust and things like that, but at least there are a set of standard procedure and manual that they can follow, and the same with the community over there. They need to look after it, so we need to train them. So we will do the training for them. Yeah.
Yeah. Hi, my name is Debbie. I'm an engineer from UNSW. I also have a question for the last session. So since you're gonna put the PV system, it's more technical. Since you're gonna put a PV system in a floating, have you considered a corrosion to the PV system itself? Is the first question. And then the second one, how do you think like it will probably last for the system? Is it 20 years, 30 years? Yeah, that's my question.
Probably I can answer the second question. I'm not sure how long, but I will ask Vicky to answer the first questions, because one thing that we're trying to do also is trying to actually making it simple, So when you're looking at all of that technology, it's not like a brand new rocket science technology, but something that works, so obviously the, seawater reverse osmosis, that salination is like standard, and the same with Rankine cycle, that's standard, so it's not like a rocket science, but integrate them and making sure that can be useful for the community. And that's the main thing, They don't need the rocket science, they just need something that works. But for your first question, I'll let Vicky to answer. Vicky, would you like to answer that?
Yes, for the question is
The PV system.
The PV system. Okay, the PV system is simple about technology. It's like our electricity in our home, and our technology is just like water production in our home. So the farmer, our goal is the farmer can operate by itself. So now in the Pamekasan, in our project, the farmer can operate by itself. We just give them SOP, yes, produce. We just give them the SOP, then can they operate by itself because it's simple technology. It's like we produce our water in our home.
Yeah,
Like this.
Vicky, I think Debbie question also whether it's going to be corroded.
Yeah, because you're gonna put it in floating, right? Or it should be on the land.
Is that floating, your PV system? Or is on the land?
Oh, the PV system is on the land.
Yeah.
Oh, okay.
Like
I
our
should show you the picture. I
playground.
think it is on the land, yeah.
Oh, okay.
Okay.
Yeah. Okay. Thanks, Vicky.
Yes.
I'm going to use my chair privileges again, or the fact that I've got the power of the microphone, to go back to Pak Sujarwoto and to your comment as well, because, one thing I'm quite interested in, I know, mental health is like the next health crisis, right? And, I know Indonesia really has, I've learned through some other work that Indonesia has a very few psychologists, very few psychiatrists. It's very difficult to get medicine. It's very difficult to get services outside of major cities for mental health issues and so on. But something I've kind of come across recently is around, self-help groups, so kind of peer support. And I wanted to ask perhaps both of you, but you as a speaker first, and you talked about this idea about community support and what's that kind of community social capital. So, what do you kind of see as the a bit more of the nitty-gritty of the solutions to this? How can policymakers, local governments, village governments really support addressing this mental health issue?
Yeah, thank you, Liz, for the important question. So, agree with you that mental health in Indonesia is still left behind, but fortunately, since last year, the government established new regulation on mental health. This is very good news, and one of them is including mental health as a care, especially in primary health care. So this is good news for us as well, because long time ago, mental health is not concerned as a health, but now as part of health. And with the new policy, then we hope that in the future, mental health services will be improved in Indonesia. So, and then your question about how to empower village community. Well, there is many initiative in Indonesia. Well, for example, we call it Posjandu, Pos Pelayanan Terpadu, or Pos Bindu, Pos Pembinaan Terpadu. It is community-based healthcare by what we call voluntary health cadres. So, for example, now there is some initiative from local government, say for example in Malang, and they doing a screening of mental health, yeah, using maybe SQ, using standard screening for mental health. So we have some information about individual who have risk to mental health. With this, then we can focus on that. The data can be used by the government to provide the services. And the other example is that the issue of Indonesia with regard to primary care is fragmented care, right? Mostly fragmented care. For example, if you have mental health problem, then for example, you will be identified in the village, but sometimes the data is not send it to primary care, and the primary care is not send it to hospital, and then you just we know that you have mental illness, but they don't receive like sustainable or continued treatment. Yeah, so now some government have initiative of that, how to build integrated treatment from primary healthcare, which is preventive healthcare, to treatment care. So this is a good news, but of course there is long to go, because building integrated primary care is not easy. I think this is my answer.
I am interested in your view as a psychologist, actually. Can I ask you?
Okay, thank you so much for the questions. So I would like to just adding like more information from Pak Sujarwoto already like mentioned, which is, yes, Indonesia is currently like trying to progress in the mental health system development in our country, which is, for instance, in Jakarta itself, like most of the primary healthcare already have their own psychologists. And, but the problem is, another thing that might be we need to also like concern is also like it's not about the number of psychologists only, but about the proportional between the psychologists or the psychiatrists in Java area, in urban area, compared to the one who is in the like outside of Java Island, as well as the one that has like in the rural area. So it could be also like maybe like another challenge that will be, you know, like solved by maybe like a more integrated like a policy, like a sending like a psychologist to go to the like a more rural area, and whether the psychologists want or not, that's another problem. So that's the thing. And then the second one that I would like to add as well, beside the service that will be like provided by psychologists, if we talk about the mental health issues, it's not only about talking about the curative one, not about the treatment one, but as well as about how to like prevent, as well as like how to like promote the mental health itself. And I think with this community support system, what I'm thinking is also important is to integrating like some mental health initiative, well-being initiative, not only for the treatment, but also for the prevention in the school, for instance, in the organizations, in the companies. And I think the problem should start from raising the awareness and then the literacy about these issues. So every like a policy maker in school, in university, in organization could also like apply some their like own local policy to develop some mental health or like well-being initiatives. So it could be like a preventive. Because what I know currently is not all, for instance, in the higher education system, not all university has their own psychological counseling clinic, which is, it is also like being like a barrier for young people who has like more lower access in terms of mental health service because of the financial issues. They couldn't reach out to the like a private clinic, but they also couldn't get the treatment as well in the uni because the uni didn't provide that. So I think the priority about the mental health and well-being itself need to be strengthened first, and then much more focus on the prevention, on the promotion of the mental health issues, as well as how to make the treatment is more accessible. Yeah, currently I'm also like running a project funded by Koneksi to improve the accessibility of mental health service in Indonesia using a web-based intervention, and we are currently like running some co-design workshop, as well as we'll run some pilot trial and randomized control trial for the next year. So let's see how it goes. If it works, then it could be like one of the potential solutions that could be implemented in the future. Yeah, thank you so much.
Thank you so much for sharing that, because that was my other thought around this kind of web-based approaches, right? You know, so many people have mobile phones, so many people, much more people have internet access. Yeah, interesting.
I just want to follow up the question from Pak Sujarwo regarding your research in terms of like suicidal ideation. I just want to know about the segregations of the data in which that you said that the highest proportion lies on men. So what is like the range of age between the participants who take part in the research from like demographic health survey? So like the age range like that have a high percentage of suicidal ideation. And the other one, like what are the triggering factors that mainly cause the men to have like such high suicidal ideations like within the community? Thank you.
Well, I think this is an interesting question as well. So with regard to the first question, so we found that the older group, have older group high risk of suicidal ideation, like what I explained before. Yeah, but the range is maybe better. Better I will send you the paper that I wrote, so that you can clearly see the details, the information inside, including how to access the data, what analysis that I did, so that maybe in the future you can use data, or you can replicate, or you can do better analysis than me. Yeah, I think that's my question, my answer.
Thank you. Oh, good. I was gonna take over my chair privileges again, but yeah, great.
Thank you so much. So I'm Farida. I'm a PhD student working on perinatal mental health. So this is kind of my interesting, like a willingness to learn. So it's about mental health during pregnancy until 1 year after birth. And can I ask for Pak Sujarwato, about your insights or your findings or anything that you found from your research about mental health, particularly for mothers who are pregnant or having a baby or just 1 year after birth. So is there any insights or something that you can, explain or share to me about it? Thank you.
Okay, thanks for the question as well. from this particular paper, I not focusing on perinatal mental health, but in my other works, I work with a colleague from Faculty of Health Science, namely Ibu Heni Windarwati, who work on this. So one finding that it is very important to know is that there is a high risk of mental illness or depression among mothers who are having pregnancy. So, and we also have some, now we have some small grant to build some interventions, yeah, like what you say, web-based mental health intervention for mother who have suffering from mental illness. Well, if you want to know in detail our research, we will contact you later. Yeah, I think so.
Thank you. I also wanted to pick up on something that's come up, you know, in your paper, but also in Vika and Intan's paper as well, around this link between, and I think you mentioned around coastal communities and the link between climate change and kind of the vulnerabilities and impacts that has and kind of well-being. And I think it came up also in Vika and Intan's around, you know, what is, and perhaps you didn't delve into it in too much detail, but, you know, this link between sort of, you know, economic well-being, social well-being and environmental well-being. And, you know, it's so important for that balance, right? We need all three of those things, but sometimes getting them is quite difficult, finding that kind of sweet spot. Vika and Intan, I will ask you to comment on that as well, but while you're finding yourself on screen, I'll just ask Pak Sujarwoto to maybe comment on that. Sorry, you're right here.
Okay, so I be familiar with Indonesian Family Life Survey police. I use the data regularly before when I was my PhD in Manchester. So there are various measures of well-being in Indonesian Family Life Survey. So for example, economic well-being, and then subjective economic well-being, and then also subjective well-being in terms, measuring happiness and also life satisfaction. Yeah, but it is all subjective. Yeah, you know that subjective measure is important for psychologists, of course, but we know also the limitation of subjective measure because it is consists of social desirability bias. Yeah, so when all of us are poor, and then we not realize we are poor. Yeah. So and this is my comment on the Indonesian Family Life Survey with regard to indicator to measure well-being. And the second thing about coastal community. So maybe if you are interested, I will share my paper, which is recently published in scientific papers. We try to examine, using the same data, we try to examine how actually natural hazard related to climate change actually relate to depression among individuals within this area. So we found that people who live in coastal area where actually natural hazard related to climate change, such as flooding, typhoon, hurricane, and so on, have a higher odds to have mental depression compared to those who live similar in the coastal area but are not affected by those natural hazards. This is what we found, and this is also important information from government to look after more people in this area as well. I think that's all, police.
Thank you. Vika and Intan, would you, sorry, the camera's up there. Would you like to comment on that? Yeah, because I was kind of interested in this idea between, you know, how do you balance economic well-being and environmental well-being? It's so difficult to find that balance.
Yes, okay, thank you for the opportunity. Yes, I agree with Bapak Sujarwoto. I think it's really associated with our result because our research show that coastal area have coastal tourism in coastal area have impact on economic, but in our result, coastal tourism, this is not impact on the subjective well-being. So this is here subjective well-being here is subject to individual perspective. So maybe there is really associated with the opinion from Bapak Sujarwoto. Thank you. Maybe for my friends, will add some argument.
Yeah, okay. Hello, everyone. My name is Sifa. I'm one of the team members. And yes, I would like to just add because subjective well-being is heavily, subjective. So it is not reliable to measure the well-being of the individual. So that's why we also use a lot of other measures. As you see that we also measure the well-being from the financial aspect, right? Because given our data, it is the most measurable aspect of the well-being because our data, the Indonesian Family Life Survey, does not provide a lot of qualitative measurement of well-being if you get the idea. And we also have a variable measure of financial well-being because, we measure whether individuals live above the poverty line, whether they earn wages above the regional minimum wage and so on. So yeah, that's how we mitigate. And also there are a lot of as Liz has said before, that there are a lot of aspects of well-being that might not be able to be reached at the same time because it's difficult to find the sweet spot. And we also acknowledge this because, like, for example, if the increase of activity in coastal tourism increases financial well-being, increases wages, employment, and such. But on the other hand, it will decrease the quality of the environment, or the cleanliness of the neighborhood, for example, due to the increased activity. Like there are a lot of garbage and so on. So yeah, so there must be a trade-off in those kind of improvements. I think that's from us.
Great, thank you so much. This has been a really interesting session. I've really enjoyed, hearing all these different research. I'm going to look up some of your papers. I'm going to look up your paper, and I'll have lots of reading for the weekend. But please join me in thanking our speakers here, Pak Sujarwoto, our speakers online, Caroline, and thank you all for participating in the exchange. Go and grab yourself an afternoon coffee and something sweet to eat to get through the last session. Thank you so much, everyone.